Hope Channel, changing lives.
Good evening, lovely viewers, and welcome back to another episode of The Consulting Room. We come to you live from the studios of Hope Channel Ghana every Monday from 8 to 9 p.m. It's always a pleasure to have you join us week after week. On The Consulting Room, we bring you the most relevant health topics, and it's absolutely free. So call a friend to join in, send the link on YouTube, on Facebook, and let's learn together. I'm Dr. Nai Kanko Inin. Tonight we have another very interesting discussion. We are talking about pediatric cancers, navigating the ordeal. And as usual, we bring you the best. And we have the expert here. She has the experience and all the knowledge to tell us about what pediatric cancers are and what we should do about them. What do we do before the diagnosis, after the diagnosis? We're going to learn all about that tonight. So thank you for joining us again. We have with us Dr. Samira Yamyulia, and she's a pediatric oncology fellow at the Kolebu Teaching Hospital. Dr. Samira, thank you so much for joining us tonight.
Thank you very much, Na, for having me.
Yes, yeah. I believe you're a very busy person, so thank you for taking time out of your busy schedule to join us tonight.
It's always a pleasure to talk about childhood cancers.
Yeah. So we'll get into the discussion shortly, but you can send in your questions and comments as you follow this discussion. We would love to hear from you. Please do stay tuned. We'll be right back.
In Luke chapter 10, verse 38 to 42, it talks about Mary and Martha while Jesus visited them at home.
Yeah.
What's your take on Jesus' response to Martha that Mary had chosen right? Ernest.
Okay, for me, I think it's about priority. Okay. Mary decided to sit at the feet of Jesus and listen to the word of God, while Martha chose to be in the kitchen and cook.
Okay. I'll beg to differ. I think they needed the food to get the energy to have that discussion in the first place. So from that perspective, I think Martha chose right.
Well, I'm not trying to say that Martha didn't choose right, but what I'm saying is, it's about placing God first.
Chaplain, what do you think about what Ernest is saying?
So like Michael, Ernest, and Finley, this is why you need to join us on Hope Bible School. Here is where we study the Bible to understand what it truly means. You also get to ask all the questions that bothers your mind, from politics to health to doctrine to anything that is bothering your mind. We have introduced a segment in the program which we call the SACS moment, which is simple answers to sample questions. And so we will answer all your questions for you. What is more, we also get to treat you with beautiful music from our array of musicians that we have. And so join us on Hope Bible School and let's study the Word of God together.
Welcome back to the consulting room. Before the break, we spoke about our topic. We're talking about pediatric cancers, navigating the ordeal. Cancers are a terrible diagnosis for everyone, and children are not left out. Tonight, we're talking about cancers in children, and we have Dr. Samira here with us, and she's an expert, and she's going to tell us all we need to know about it. So please stay tuned. Doc, you're welcome again.
Thank you.
So cancers, we've heard of cancers, but maybe you can just shed a little light on it. What is a cancer? What is cancer?
Okay, thank you. So cancer refers to, so let me start by talking about how cells are in our bodies.
Okay.
So every part of our bodies, right from our hair to the tip of our toes, is made up of cells. And these cells are programmed normally as to how they grow and then how they die off and then new cells regenerate.
Okay.
However, sometimes along the line something happens, and then the normal control of how cells develop and then how they are supposed to grow and die off changes, and then you have cells growing abnormally out of proportion from what is normally expected. And that is what we call a cancer. The thing about cancers is that as these cells have grown and they are abnormal, they do not stay just where they are. They have the ability to spread to other parts of the body. So that's what we call, that's why we say they are malignant cells. The malignant cells have the ability to spread to other parts of the body and then to cause destruction to other parts of the body.
Okay.
Yes.
Okay. So we are saying children, we're talking about children today. Which age group are we talking about?
So right from birth until, in my unit we see up to about 18 years.
Okay.
Yes, so right from birth up to 18 years.
Okay. So are there any statistics in Ghana supporting the type of cancers we have for children and how often we see those type of cancers?
So the commonest cancers that we see here in Ghana are the leukemias, that's the blood cancers.
Okay.
That's the first. And then followed by the lymphomas.
Okay.
And then we have retinoblastoma, which is cancer of the eye.
Okay.
And then the cancers of the kidneys.
Okay.
What we call the Wilms tumor or nephroblastoma.
Okay.
Those are the commonest that we see. We also have the Burkitt's lymphoma I mentioned as part of it, where you have the jaw swellings and abdominal swellings. Yes, these are the commonest ones we see.
Okay.
Yes.
Okay. Are they all deadly?
So the good thing about childhood cancers is that majority of them are curable.
Okay.
If caught early.
Okay.
So that's where the problem comes in, when it's caught early.
Yeah.
In the advanced countries, survival rate is up to about, they're able to cure up to about 80 to 90% of their cases when they present early. And unfortunately, it's not the same in our situation because of our, there are still a lot of people who do not believe that children can have cancer. So there's always the late presentation. That is what causes most of our outcomes to be poor. Otherwise, when everything is put in place, you have the best of settings. Up to about 90% of our childhood cancer cases are curable.
Okay, oh, that's good news. But what causes children to have cancer?
So unlike adults, when you can talk about risk factors such as smoking causing lung cancer, and then you know about cervical cancer and all that, in children it's really difficult to tell. There are a few things such as certain of course, when you have a first degree relative having a malignancy, then your chances are a little higher and all that. But you can't really pinpoint a particular cause to say that this is what causes childhood cancers.
Okay. So then what do we look out for then? If we need to catch it early, what signs and symptoms should we look out for?
So we have general warning signs which you talk about. So I mentioned that we have the commonest one. So I'm going to start from the head. Okay. So any abnormal swelling that you find in any part of the body. You have a swelling on the head, you have a swelling on the neck, on the jaw, on the arm, or any abnormal swelling that you can't really, of course, if it's not as if when a child falls or something else. But when you have any abnormal swelling or lump in any part of the body, then when you come to the eyes, so retinoblastoma, which is a cancer of the eye, the commonest early sign you see is a white patch at the pupil. Okay. So instead of seeing your black pupil in the middle of the eye, you see a white patch. Okay. And in such children, even when you take a picture with a camera, you realize that even the flash, you can actually see that there's a white opacity at the eye. And the eye. And then you can also have squints, so abnormal positioning of the eye. Okay. And then move on to the jaws, which I've talked about, the swellings. And then the blood cancers, usually they would have, you'll notice that the child is usually very pale. The children are weak. And then there is a persistent fever that keeps coming. Okay. And you keep treating all sorts of things, all sorts of infections, but this child is always having the fever. Then those who are, sometimes you have easy bruising. So you notice that a child who is was just playing, you just notice like a red patch on the skin as if the child is bleeding under the skin. You also have swellings of the joints. Children always holding their joints, complain of severe joint pain. These are all signs of the cancers. You also have abdominal swelling. So a child that is just there and suddenly abdomen is just getting bigger and bigger. These are signs that you should go to the hospital. You also have cancers of the bones. So you can have an abnormal swelling in any of the joints or even any of the bones. And then you notice that a child cannot even use any of those limbs. Or anything that's an unexplained weight loss. A child is just losing weight for no reason and always feeling unwell. These are all signs that a child should be investigated for cancer.
So as a parent, you've seen one of these signs or symptoms in your child. Do you just report to a general doctor or do you go straight to the pediatrician?
So you can start at the general doctor. Because in our country, you know that access to specialist care is not always available. But at one of the things that one of the most important things now is advocacy. So even at the basic level, to the extent that even there's even been training for even the community health nurses who are doing child welfare weighing, so that they are able to even recognize some of these signs. So right from that side at the community level where children go for weighing, you know, almost every child goes for weighing. Even at that level, yes, it's a project that's ongoing. A lot of them are able to recognize at least various early warning signs. And then you see a general doctor who, of course, will refer to a higher hospital if it's required. Yes.
So after picking up these things, how do you go on to say that it's cancer, it's actually cancer? How do you diagnose it?
So diagnosing cancer depends on the type of cancer it is and then where it is coming from. So the basic labs, laboratory investigations will do the blood tests. We'll do multiple blood tests. We want to know how your general well-being, how your kidneys function, how your liver is functioning, how your blood cells are. Remember I mentioned that the blood cancers are some of the commonest. So we look at what we call the full blood count, to look at the various indices in the blood. And it's actually quite telling. That alone can give you a very good idea of what is going on. There are further testing such as imaging modalities like MRIs of the brain if you're thinking of a tumor in the brain, scans of the abdomen, of the spine, depending on wherever we suspect that the tumor is in from our examination and history taking. And then
So in a normal circumstance in the clinic, you think a child has cancer. How do you go about breaking the news to them or to their guardian or parent?
So, of course, counseling is a very important part in my work. I do counseling every day, and it's a skill you develop when you keep doing. So, as much as the news may be difficult and heartbreaking, it's also important that the parent actually understands, the parent or the caregiver understands the entire condition. That actually helps them to make it helps with parents getting committed to the treatment. So when the parent really understands what is going on, so of course you have to get a good setting, and then you explain as much as you can to the parents about what is going on. We can't keep information. You need to let them know what it is, and then you do it in a way that the parents knows that the child is sick, understands that the child requires treatment, but also understands that there is hope. It is not entirely hopeless. So we have, so in our counseling, we have a lot of survivors who are also around and all that. So it helps a lot in our counseling.
But from what age would you usually tell the child themselves?
So when it comes to telling the child, we usually encourage the parents to start it. It's quite a difficult situation sometimes, because sometimes you have a teenager and then the child is coming to the hospital. Parents haven't told her, at that teenage time, that's when the children are very inquisitive. They are rebellious. They won't understand where they come. So it's a process. It is not something that you sit at once and call a child and say you have this cancer and all that. So first of all, you need to empower the parents to understand what is going on, and then they start it gradually, systematically. And then when they understand, when the children, especially the teenagers, when they really understand it, even they sometimes even know details of their treatment more than their mothers. Yes, and it really helps. It helps in it helps in compliance when the child actually understands what's going on. Yeah.
So in this country, we have a lot of traditional mindsets. What are some myths you've come across relating to childhood cancers?
So the first one is a lot of people do not believe that children can have cancer. It's when you ask parents, most of the time when you ask them whether they've heard about cancers, the first thing they mention is breast cancer or cervical cancer. Those are the ones that they know. You ask them, do you know children can get cancer? No. And then you now try to explain. People are different. Some would understand it and accept it very early. Some would still have their doubts. It takes a while. They go and read and all that, and then they come back. But yeah, some it can be quite stressful sometimes. Yeah. Someone accusing you of giving a child a strange illness. And sometimes it's you, the caregiver, that's the healthcare worker, that's the problem. Yes, but most of the time, now there's information on the internet, so most of our parents who are able to read, and people actually read, and it helps because they get to understand what you are trying to do, and then you are trying to help the child, and then it actually helps with the treatment. It helps with compliance to treatment.
Right. So you mentioned while diagnosing, there are a lot of tests and investigations that need to be done. There's a lot of cost. Is there any help available to people who need it?
So I think about 2 years ago, some of our childhood cancers were added to the NHIS.
Okay.
Even though it doesn't cover everything, it sort of helps with admissions and brings down the cost of a few things, even though it's not entirely.
Okay.
And then apart from that, we actually have a few NGOs. We have other organizations that come to the aid. We have World Child Cancer. There are a few of them that actually support. And then there are individual Ghanaians who actually just walk in and then say they want to support.
Okay.
And you'll be surprised, we actually do have a lot of well-meaning Ghanaians who actually work in to support. Cancer treatment it doesn't come cheap. Not just even the money aspect. Imagine a mother lives in a child from other regions, because in Kolebu we are not just taking care of children in Accra.
Yeah.
People are coming from BA, some are coming from the Volta region, and then because you have to be coming frequently for treatment, some of them will actually have to come and be staying in Accra. Yeah. So all that time, and then being unable to work, because if you are here, you're leaving your job and you're taking care of a sick child. So all that cost is also there. Not just the monetary aspect, the social aspect and all that.
Yeah, that's true. But you mentioned the symptoms and signs of the cancers. Is there something we can do to prevent these cancers at all?
So, as I mentioned, we do not really know what causes. There's really not a single cause, and it's not somebody's fault. So it's we don't really have preventive measures per se. The most important thing is recognizing the signs early and presenting to the hospital early for treatment to start.
Okay. And what are treatment options?
So, treatment options, currently what we have in Ghana, we do chemotherapy, which is with different drugs, we have different protocols for different types of cancers. Then there is radiation therapy. There is radiation therapy, there's also surgery. So if you have a lump, you have a tumor. And there are lots of other modalities, which some of them may not be available here, like bone marrow transplants and all that. So when we have patients who require that kind of treatment, then we make arrangements for them to receive it in more advanced countries.
Yes, because I was coming to that. Like, do we have all the various modalities of management here?
Unfortunately, not everything.
Yeah, okay. So in the cases where you have to let them go elsewhere, that's still cost, right? So they have to bear it by themselves?
Oh, I'm sure you've seen a lot of fundraising drives on social media and all that. Yes, that's actually what happens. When it's like that, then the parent has to find ways of raising funds. We support how we can. We also share the flyers because, of course, there are children that we take care of. My unit in Kolebu is like a family. Like everybody knows everybody and everything like that. So we actually support in whichever way we can.
Okay.
But to raise funds to go out of the country is usually the parents who go to do the fundraising.
Okay. But what is needed to start treatment? As soon as you diagnose cancer, can you start immediately?
So once the diagnosis is made, treatment as soon as possible is important. But you also need to, treatment also depend on the staging, how healthy you even are, because we are talking about chemotherapeutic drugs that are also that are usually also toxic. So you have to ensure that the body is actually strong enough to even stand the chemotherapy. Then you also want to know the extent of disease. After I've mentioned that it's cancer spreads, so you need to know the extent of disease, whether there's distant spread, is it how big it is it affecting other organs and all that. Those are things that you need to consider. And then the most important thing is the counseling for the parents to be able to understand how long the treatment duration is and what it entails, because they really need to be compliant and all that. And then you go on to start. Counseling is actually the number one thing that we do. And then we go on to do the staging, we do the assessments to look for spread in other places with the scans and everything that we do. And then as soon as we have all those things, we start treatment.
Okay. What are some of the common side effects with the chemo? Okay.
So chemotherapeutic drugs, usually most of them are cytotoxic, means that they break down cells.
Okay.
So they are breaking down your cancer cells, but then you also have cells, rapidly growing cells in your body. So the commonest one we see is your hair. Most of them lose their hair, but the good thing is that as soon as the treatment is over, the hair grows back.
Okay.
Then you have also the toxicity to your own blood cells, because they are also rapidly growing cells. So you have your cell lines, the blood cell lines also going down and all that. And then there is the good thing is that there's always treatment for these things.
Okay.
And then, because the commonest is also nausea and vomiting. Yes. And then most of these side effects are treatable.
Okay.
Yes.
Okay. You mentioned the mets, so spread to other parts of the body. Which sites are the most common places you have the cancer spread into? So
different cancers spread to different places.
Okay.
But the commonest ones we see are the spread to the lungs, to the liver, to the brain. Those are the commonest ones that we see. Those are the ones that we're most worried about.
Okay. So even with the spread, can they still undergo treatment?
Yeah, it depends.
Okay.
So depends on, for example, the nephroblastoma, that's the ones with the kidney, they actually usually respond to treatment. It depends on the type of cancer. The response to treatment is actually quite good, and we actually give them a try even when they're spread.
Okay.
There are a lot of things that we would assess to see them, and then before we make the conclusion that this is difficult to treat. Even though, yes, so once they're spread, it is difficult. It is more difficult to treat, but we don't say we won't treat just because they're spread. Some of them actually respond.
Okay. You mentioned radiotherapy as one of the ways of managing it. So what exactly happens in radiotherapy?
So they use radiation. We have radio-oncologists. Yes, radio-oncologists, radiation oncologists. That is their specialty. So they use radiation to sort of kill the cancer cells at specific areas. So they irradiate the area where the cancer is.
Okay. So you mentioned staging of the cancer. What is that?
So staging. So different types of cancers have different staging modalities. So a cancer is at one place. It's like that's a stage 1. Then you talk about spread to organs just next to it.
Okay.
Then there is distant spread. So once you are looking at distant spread and all that, then we are heading towards stage 4.
Okay.
Yes.
Okay. Okay. And you mentioned the duration for treatment. I'm guessing it differs for the different types of cancers,
yes,
right?
It does.
Yeah, but is there like an average?
So there are different types of cancers, like I said. There are, most of the ones we see range from about 6 months. That's when 6 months. That's for 6 to 9 months for the kidney, and then the one for the eye. That's when there is no spread, because it can be longer.
Okay.
That's why you can't really. It depends. It depends on. We look at it on the case-by-case basis.
Okay.
But the leukemias generally is about 2 years for girls and 3 years for boys.
Okay.
Yes.
Okay.
And then, so some of them are shorter than some.
Is there any reason why it's longer for boys?
So, in boys, we are worried about testicular disease, so we extend it a little more for them.
Okay,
yes.
okay, right. So in cancers, we usually hear the word relapse. What does it mean to say relapse?
So relapse means that you have achieved remission and then it comes back.
Okay, another question.
So remission, you're in remission, you have cleared your cancer cells. You are in treatment, you've cleared your cancer cells, and then so when you go into remission, we continue your treatment. We have different phases. We have some maintenance phases and all that until we end.
Okay.
So remission means that you have, actually we can't find the cancer cells anymore.
Okay.
Then you relapse. It means that after a period of remission, then we start to see the cancer cells again.
Why does that happen?
Oh, a number of reasons. One, we can have people defaulting. So someone starts treatment, once they start to feel like they are feeling better. I mean, treatment for 2 years, some people, they start to feel that they are better.
Yeah.
And then they stop. And then after some time, they relapse and come back. Sometimes, too, some people do not just respond well to treatment.
Okay.
Some people do not respond well to treatment, and then there is a relapse.
Okay, okay. And when does palliative management come in? Or what is palliative management in the first place?
Palliative management, essentially, you are managing, not cure. You know you cannot achieve cure, but you want a person to be as comfortable as possible.
Okay.
Okay. You don't want a person to be in pain just because you can't cure the person's disease. The person should have a good quality of life, even if you cannot cure the disease. So like I said, you cannot the decision to do palliative care, it's not just taken at once. You have to consider, for example, the degree of spread. A child comes in, there's already spread to the brain, there's already spread to the lungs, there's spread to the bone marrow, and you're looking at even his labs and all that. The kidneys are not functioning well, your liver is not functioning well. Remember, these organs are important to metabolize the drugs you are going to give. So these are all things, and it's usually a multidisciplinary approach. When I say multidisciplinary, it's not just the oncologist. You discuss with the surgeons, you discuss with the radiation oncologists, you discuss with even clinical psychologists. We actually have those meetings before we can make a decision that this is not something that we can cure. That is how we go about it.
Okay, okay. But what are some of the complications that come along with the cancers?
So, complications with the disease itself, and then we have complications with the treatment.
Okay.
Okay. So the disease itself, for example, you have a tumor of the bones, then even though sometimes you can do limb sparing surgery, sometimes you would have to have an amputation for the limbs.
Okay.
Then because the diseases like the leukemias, because it's attacking your blood cells, your blood level is usually very low. You would have severe anemia, you need recurrent transfusions. Transfusions also have their problems. Then you have infections. Yeah. Okay, because the disease itself, so that can actually be the disease itself, and then it can also be a result of the treatment. But your drugs are also cytotoxic. So like I mentioned, they are breaking down your cells. Your immunity is reduced. So you have an increased chance of getting infections. But there's always treatment for that. We manage the infections. And then social complications like not going to school and all that. Because once you're on treatment, we usually recommend that you avoid crowded places, such as schools, churches, markets, because if you have low immunity, you don't want to go to a place where there are so many people and then you end up getting infections.
Okay.
So those are some of the things that I can offer.
Okay. Thank you so much, Dr. Samira. We are learning a lot. We are learning so much. I'm sure my viewers are enjoying this conversation. We'll take a quick break here, and when we get back, we'll continue with our conversation.
Calling all churches, join the National Bible Bee.
You will think that the Messiah appears only in the New Testament. But which text? In the Old Testament, the Anglican Church of Ghana.
Isaiah chapter 53, verse 47.
And that is correct. So 15 words are scattered on a crossword sheet. They would need to identify all the words within 3 minutes. Now, the person who finishes within the time first also win an extra 3 points.
Don't miss out on the opportunity to participate in the National Bible Bee. Register your church today and inspire the youth in your congregation to dive deep into God's Word. Register now and inspire the next generation. For more information, contact us at 0248 176916 or 0508 080774. Email nbbghana@gmail.com. Don't miss out on this incredible opportunity to make a difference in the lives of the youth within your church community. The National Bible Bee, implanting the living word through the written word. General Conference of the Seventh-day Adventists West Central African Division Health Ministries Department invite you to attend and participate in a special event of Adventist AIDS International Ministries, AAIM, of the General Conference. Theme: Sound the Trumpet on HIV/AIDS Infections. Date is 14th of February 2024. Time 9 a.m. to 12 p.m. Speakers: Dr. Paul Amutreme, WAG Health Ministries Director; Dr. Sikwao Bagwato, GC HIV/AIDS Coordinator for Africa. Topics: the classic view of HIV/AIDS in Africa, focusing and refocusing; the transformative and restorative dynamics of AAIM, focusing and refocusing. The event will be live on Zoom meeting ID 994-6238-3729, passcode 831838, Facebook WAG Health Ministries, YouTube WAG Health Ministries. All are cordially invited. In a world filled with uncertainty, there is a beacon of hope. Introducing Hope 365, Daily Reflection for Victorious Living. This devotional masterpiece is not just a book. It is a guide to a life of comfort, faith, and hope in the Lord. Each day, Hope 365 brings you a powerful combination of a hand-picked Bible verse, a thoughtful reflection, and a prayer designed to bring you closer to God and His endless hope. This book is for every Christian who desires to grow in the Lord in a victorious Christian life. Grab your copy today and begin a journey of hope and resilience. This can be a perfect gift to your family and friends this holiday season. For copies, call 020-4372-211 or 0243-851-636. Hope 365, Daily Reflection for Victorious Living.
As a small business owner, Metaisha Business Forum, our Hope channel, it really helps me with my business.
Don't let your priorities be because obi eye bibinti. Also we share some why one kasa sawasa. So jani ni obiani. Okay. Obiani need so that ungofa a problem embawash.
In the first place, business a risk.
Okay.
It's just all about risk. Now pursue your business, so now you need you should be a risk taker.
Okay.
I would recommend it to you to Mesresa Usu Beshebi.
Welcome back to the consulting room. We've been talking about childhood cancers and how to deal with them, how to manage it, what to do when you're diagnosed, and the way forward. And we've been talking with Dr. Samira Yamyulia. So before the break, we were talking about the complications, but the effects of childhood cancers, what's the effect of that on the child and then the family and maybe the nation as a whole?
So childhood is an interesting time. That's when children are learning how to, they are learning how to grow, they are learning about their environment, and then suddenly you tell a child that he's sick because of that, he doesn't go to school, cannot go to places where other children are. So first of all, the child is wondering what is wrong with me. Yeah. It has a great toll on them psychologically, and so they need actually a lot of support. You need a caregiver who even understands. The caregiver himself has to actually understand what is going on and then give this child support. And then they actually understand more than we think. Because usually when you talk to them, they can actually tell you what they are going through, and then when they get to understand it, they know why they need the treatment. It actually helps them a lot. Okay. Then apart from that, schooling, because they have to stay out of school for a long time, it actually affects their education to some extent. But not being in school doesn't mean that they cannot learn. We are in a stage where everything is available online. We have learning resources online. There are even schools that give them the option of joining in virtually, so they are not left behind their peers. Yeah. And then the issue of stigma. A child without hair, you've lost your hair, or a child with an amputation, even trying to get back into society. Our society is not very, it's getting better, but a lot of people do not really understand these things. That's why we actually do a lot of advocacy. It's there's a lot of stigma. People think that the disease is from a curse. Somebody thinks that because of a curse. Someone thinks that it's contagious. So they actually get a lot of problems like that socially. Now when it comes to the family, there's a lot of time, should I say productive time lost by parents. Like I mentioned, we have somebody coming from other parts of the country, and then your child has leukemia, has to go through treatment for 2 months or 2 years. It's difficult to be coming, you can't come, sometimes you're coming weekly, sometimes you're coming monthly, and then people actually have to move their entire lives to Accra just for treatment. So there's a mother that is not working, has a child that is unwell, and then also has a lot of financial burden. So it's not the child. It's not the child alone that's suffering for having emotional problems. It's also the parents too, because then usually they are not only. This is not an only child. They have other children too. So it's really difficult, and such families actually need a lot of support. The support is actually very important, and now unfortunately they are rather met with stigma instead of social support. And then for the country, of course, is the our healthcare facilities.
Yeah.
And then there's a lot of money involved in managing the cancers, so the cost on the healthcare facilities and then the families.
Right. Yeah. So you mentioned the support. Is there any support for not just the child with the cancer, but the parents themselves?
So we offer clinical psychology services. Like I mentioned, managing cancer is multidisciplinary.
Yeah.
It's not just a doctor alone. It's not just you, the oncologist. There are other people that come in. We have physical therapists. We work with clinical psychologists, even psychiatrists. And then we usually let them involve everybody. In Ghana, everybody has something they believe in. Christian and Muslim, traditional believers. So we usually they usually get support from the religions that they belong to. So you can have a priest being involved and all that. Okay. All those things are support systems that help.
Okay. Okay. Are there any special dietary recommendations or nutritional recommendations for a child undergoing treatment? So
we just recommend a normal balanced diet, because remember, these are growing children. They need their nutrients to grow. What we are worried about is food that is not cooked before eating, because remember, I've told you that their immunity is actually low. Yeah. So we wouldn't want you to be eating foods that are not cooked. So for example, raw vegetables need to be cooked. Okay. Yeah, if you are going to eat a fruit, you prefer a fruit that can be peeled. Okay, because
like a banana.
Yes, that can be peeled. Okay. If it's apple, you would have to take off the peels to eat what is inside, because generally there's a lot of contamination around, and it's difficult to tell. You can't see some of these things with your eyes, and yes.
Right. So there's a question here. What are some coping mechanisms for a child with cancer?
Coping mechanisms. Well, we actually have in my units there is a child life therapist who actually helps these children with music. You're helping them with music. You're helping them with videos. There are some apps that she uses to help them express how they are feeling. Okay. And then music, they do a lot of artwork. It just helps them to actually stay busy, to not to feel that they are different. Yeah. Not to feel that they are left out. So there are a lot of things that they do, like the artwork, the music, and then just playing with each other.
Okay. So another question: are there any alternative therapies that can be used alongside the conventional cancer management you mentioned?
Alternative therapies. So for my line of work, what I have seen and what I've learned that works is chemotherapy. Unless when you talk about alternative therapy, unless you're talking about things like the music therapy and things that to help you to relax. Otherwise, from the best of my knowledge, this is what I know works for the treatment of cancer.
Okay, so just to add to that, there are people who go by herbal treatment, whatever disease it is. What do you have to say to that?
Again, like I said, for my training and my work, I know what I have seen works is the therapies that we give. I haven't seen any documented proof of other herbal remedies. Yeah. So that is what I know works.
Okay. So someone is asking, how do you talk to a child about cancer and death?
It's a whole course. Like I mentioned earlier, it is not a one-day thing. It's a process. So you start it as a process. First of all, getting the parents involved into let the child know what it is. So gradually you disclose what it is, and then you let them know. Yeah. Children actually have wishes. A few years ago, I don't know if you remember, but there was a child that he was on palliative care, and his wish was to enter an aeroplane.
Oh.
And Kolebu, yes, it was actually arranged. This child went to Kolebu, got into an aeroplane, sat in the cockpit with pilots.
Okay.
And that was his wish.
Yeah.
I mean, these are things that it's we do it.
Yeah.
It's not difficult. It's not easy, but it's something that you do, and it's a process. It's not a one-time thing that you do. It's a whole process. It takes. It's a skill that is learned over time.
Okay, there's another one. What advancement or ongoing research is there into pediatric oncology?
Oh, there is a lot of research ongoing. There are a lot of trials, even though we haven't really started our own clinical trials here yet.
Okay.
But there are different new therapies that are coming up all the time for different cancer treatments. Even the local protocols that we use in treatments in our centers are constantly changing based on new knowledge that we get from research that's done. Right.
So I think you've answered this one. Can pediatric cancer impact a child's mental health and emotional well-being? Yeah. And also, what role do genetics play in the pediatric cancer risk and then treatment?
Okay. So, genetics, I mentioned earlier, because we're not going into the details of the various cancers, because there are different mutations that go on.
Okay.
Like I mentioned, if you have there are certain genetic conditions that put you at risk of tumors. We have things like neurofibromatosis. We have, and also things like, there are certain type of cancers that have a genetic predisposition, like the retinoblastomas. There's a type, commonest one is usually incidental, but there's also a type that once you have a family member who has had it before, there's an increased risk of you getting it.
Okay.
If a parent has had cancer or had cancer as a child, the risk of a child getting it also increases. So we can talk about genetics on based on the type of cancer we are talking about.
Okay.
And then there are different mutations to that occur in the different
types.
Yeah.
Okay. Okay. How do you respond when someone tells you that their child has cancer?
Let me ask, is that as a healthcare person or like as a...
Maybe both. Maybe you can do both.
Well, you, as a person, you need to empathize. Of course, it's not an easy situation. Like I've mentioned, I've talked about the kind of things that they go through. It's not an easy diagnosis. So this parent that is telling you this is already going through a lot of stress. We need to empathize and then find out how you can help. Sometimes they just need somebody to talk to. Sometimes even the financial burden of it, people will not come out to say, but yeah. So it's empathy and then supporting whatever way that the person needs. Yes.
Yeah, yeah. Are there any long-term complications of the treatment for pediatric cancers? Long-term effects or complications?
So, long-term effects. So, the drugs themselves, I've said there are certain groups of drugs that have long-term effects on there are some of them that have long-term effects on the heart, so you need to be monitoring how your heart is functioning. Then you have even there are certain even chemotherapeutic drugs that also are actually a risk factor to getting cancers. But it's not something that's common, but it happens. It's a possibility, but it's not very common because you are using cytotoxic drugs and then long term some of them can have other cancers. And then there is the long-term disability I've mentioned about those who need to have amputations. And then those who have the eye cancer, sometimes the eye actually has to be removed. So yes. And we've had children who have had it bilateral, meaning the cancer was affecting both eyes. And those children can end up losing both eyes. So these are some of the long-term complications.
Okay, since you mentioned that, so with a child who has to have both eyes taken out, or maybe even one, what are the options for them? What can be done for them?
So usually they put in prosthesis.
Okay.
If it's just one eye, even both eyes, you will get a prosthetic eye. But that would also mean that you would need to support this child as somebody with a visual impairment. So we have school for the blind. We have, in this country, we've had lawyers who are with visual impairment and all that. So all hope is not lost. It's about, that's where the support still comes in. Yes, you need to have parents that are willing to help this child to get an education. You would manage this child as any child who has a visual impairment. So anything that will help them to be able to go through education, able to move around and then support themselves is what you'll be looking at to do for this child.
Right, okay. This might be our last question. So how does pediatric cancer affect a child's development and growth?
Okay. So at that time, at the time of diagnosis, if a child is previously well, of course, I've mentioned that they get quite sick during the treatment. So there's a lot of nutritional issues over there. So that's what will affect their growth because because you are unwell, you are not feeding well, you keep vomiting, you will have nutritional problems. And if you have nutritional problems, the chance of you having more nutrition is also over there. But the good thing is, like I mentioned, after this treatment is over, most everything goes back. They start to develop there. Even while on treatment, so it's part of our treatment to help them with nutritional support. Because you have to ensure that the child is more nourished to even be able to take the medication. So after the treatment, and then when their appetite returns, these children are actually able to catch up. So it's only for a period of the treatment, and it's not even all the types of cancers. For the period of the treatment, and after the treatment, it goes back to normal. They catch up. We have them going. They go well. They go to university. They're able to get good jobs, and then they are working. It's only for that period of the treatment. Yes.
Okay. So from your experience, your many years of experience, can you share any success stories with us?
Oh, we have quite a number. We have quite a number. Recently, a 19-year-old girl walked in there. She actually finished, I think she was diagnosed around 11 years. She's now 19 years old. She's entering the university. And then she walked in. This was just like a week or two ago. And she was happy to see all the nurses there, everybody was happy to see her. She finished, she got admission to the university and she came to say hello.
Okay. Oh, that's nice.
There's quite a number.
All hope is not lost. So I think we'll take your closing remarks now.
So thank you. It's been an interesting conversation. Then 15th February is World Childhood Cancer Day. And there's a blood donation drive at Kolebu Teaching Hospital in aid of childhood cancer. So I want to encourage all our viewers and listeners to donate as a form of support to help our children with cancer.
Right after Valentine's Day.
Show your love. Show your love to your blood.
Thank you so much, Doc, for coming. Thank you for raising awareness on pediatric cancers. We don't talk a lot about it at all. So thank you so much for sharing your insights and educating us on this topic. I believe we've learned a lot, viewers, and we're happy to hear from you with your questions and comments. Thank you so much for joining us today. All hope is not lost after a cancer diagnosis. There's help and support available. So you just need to seek it and you would get it. So thank you so much for joining us today on the Consulting Room. We hope to see you again soon. Have a good night.
Calling all churches, join the